Hello everyone, I am Dr. Radhika PM, Associate Professor, Ramaya Medical College. Today we'll be learning about the clinical anatomy of nerves of lower limb part 1. Disclaimer, all the images and videos used in this presentation are from textbook of anatomy, various internet sources. The images are used for teaching learning activities only. The video is done to help the undergraduates understand the clinical anatomy. I acknowledge the ownership of the images and give complete credit to them. Coming to the specific learning objective, the student should be able to describe the clinical anatomy of nerves of lower limb. Coming to the clinical case 1, a 25-year-old male bike racer was involved in the crash that injured his right leg 2 weeks back, and he underwent surgical fixation. After the accident, he has difficulty in walking and weakness in the front of thigh. On examination, he has wasting of quadriceps femoris and could no longer extend his right knee. In this condition, we can see three important things. One is weakness in the front of thigh. There is wasting of quadriceps femoris and the person is not able to extend his right knee. So what is the anatomical basis of this condition and which is the nerve which is involved? So the nerve which is involved is the femoral nerve, and the person is not able to extend his knee because of the paralysis of quadriceps femoris. Quadriceps femoris extends the thigh and it is supplied by the femoral nerve. Coming to the anatomy of femoral nerve, it is the nerve of the extensor compartment of thigh. The root value is dorsal branches of the ventral rami of L2, L3 and L4 spinal nerves. The femoral nerve has a trunk and it divides into anterior division and the posterior division. The anterior division has two cutaneous branch. One is medial cutaneous nerve and the other one is intermediate femoral cutaneous nerve. And it also supplies the sartorius. Coming to the posterior division, in posterior division there is only one cutaneous nerve, that is the saphenous nerve, and then you have the muscular branches. There are four branches to the quadriceps femoris. So the four muscles of the quadriceps femoris are vastus medialis, vastus lateralis, vastus intermedius and rectus femoris. The saphenous nerve is the longest cutaneous nerve, which is a branch of femoral nerve. It runs in the adductor canal and it forms the subsartorial plexus, and it also forms the infrapatellar plexus, and it runs along with the great saphenous vein. So here you can see the great saphenous vein, and accompanying the great saphenous vein we can see the saphenous nerve. We can see the saphenous, this is the great saphenous vein, and here you can see the saphenous nerve. Now the clinical importance of this relation is, during surgical emergency procedure like venesection of great saphenous vein, this procedure is done to gain the rapid intravenous access when the peripheral veins are collapsed or invisible, such as in severe hemorrhagic shock or in trauma. The anatomy of saphenous nerve and its relation with the great saphenous vein is also important during the saphenous nerve block. So here we can see they are giving the saphenous nerve block. So care should be taken. It is done under the ultrasound guided so that you don't injure the great saphenous vein. Now coming to the second clinical case, a 40-year-old woman presents with the burning pain and numbness over the anterolateral aspect of the left thigh after wearing a tight belt. So what is the diagnosis and which is the nerve which is compressed in this condition? So this condition is called as the meralgia parasthetica. So the compression of the lateral cutaneous nerve of the thigh causes a condition which is called as meralgia paresthetica, where you will see the burning and numbness over the anterolateral aspect of the thigh. It is often due to pregnancy or because of wearing tight clothes or tight belt, or during it is injured during the surgery. Lateral cutaneous nerve of the thigh is a sensory nerve which arises from the lumbar plexus L to L3. It passes under the inguinal ligament. So here you can see this is the inguinal ligament. So it passes underneath the inguinal ligament near the hip bone, that is the anterior superior iliac spine, and it provides the sensation over the skin on the outer, that is the anterolateral aspect of the thigh. So we just have seen that the femoral nerve supplies the medial and intermediate area of the thigh, but the anterolateral aspect of the thigh is supplied by the lateral cutaneous nerve of the thigh, which is a direct branch from the lumbar plexus L2 and L3. So if this nerve gets compressed here, it leads to a condition which is called as the meralgia paresthetica. Now coming to the third clinical case, a 55-year-old woman complains of pain in the medial aspect of the right thigh for 2 weeks. She has difficulty in bringing the thighs together and she underwent hysterectomy, that is pelvic surgery, 3 weeks back. On examination, she has weakness to adduct the thigh and there is a decreased sensation over the medial side of the thigh. So here the two important things which we have to know is there is a weakness of the adductor muscles and there is a decreased sensation over the medial side of the thigh. So which is the nerve which is affected and what is the anatomical basis of it? So the nerve which is injured is the obturator nerve and the anatomical basis is loss of thigh adduction is because of the paralysis of the adductor muscles, and there is also sensory loss over the medial thigh. And here we are seeing there is a history of pelvic surgery. So during the pelvic surgery, if there is a injury to the obturator nerve in the obturator canal, that is one of the reason for the obturator nerve palsy. So always there will be an history of pelvic surgeries resulting in the obturator nerve injury. Coming to the anatomy of obturator nerve, it is a branch of lumbar plexus. It arises from the ventral division of the ventral rami of L2, L3 and L4. So obturator nerve, it has two division, anterior division and posterior division. So the muscular branches are mainly to the pectineus, adductor longus, gracilis and to the adductor brevis. So these are supplied by the anterior division, and adductor magnus and the obturator externus are supplied by the posterior division. It also supplies the hip joint and the knee joint. So if there's a pain radiating to both the joints, we have to think about the obturator nerve injury. And it also supplies the medial side of the thigh, that is the cutaneous branch. So it gives rise to the muscular branches mainly to the adductors. So all these muscles are the adductors. So if there's an injury to the obturator nerve, this results in the paralysis of these muscles. At the same time, there is a loss of sensation over the medial aspect of the thigh. Thank you.